Hi, I'm Professor Mather, and I'm going to be demonstrating blood transfusion skill validation. So before we start our procedure, we have to assess the need for our procedure and verify that there is an order placed for our doctor. And when I'm looking at the patient's chart, I do see an order for blood, 1 unit of packed red blood cells, and I see because the patient's hemoglobin is less than 7. So I'm going to go ahead and enter my patient's room. I'm closing the door for patient privacy. I'm going to go ahead and do some hand hygiene. I'm going to be doing it for 20 to 30 seconds and then apply some clean gloves. I'm going to go ahead and start my safety check. I'm checking to make sure the floor is free of clutter, the bed is in the lowest position, the collet is within reach, there's 2 side rails up. Okay, I'm checking to make sure the oxygen is working. My suction is working. My ambu bag is present at this time, and I have the suction set up with my Yonker. Hi, can you tell me your name and date of birth? Benjamin Moore, 10/25/1950. Great, Mr. Moore. And do you have any allergies? Allergy to penicillin. All right, great. Mr. Moore, what I'm going to do for you today is that it looks like your hemoglobin is a little low. It's about 6.8, and we usually like it above 7. So the doctor has ordered 1 unit of packed red blood cells to be administered for you today. Have you ever received blood before? Patient verbalizes no, they have not. Do you have any religious beliefs that prevent you from getting blood? Patient says no. All right, so this is going to take me about 15 minutes to get everything ready to go for you. The blood is going to be transfused over 3 hours according to the doctor's order. So I'm just going to go ahead and make sure you understand the procedure. So this is going to require me to get a lab sample from you, send it to the lab, verify what kind of blood type you are, get the blood from the lab, verify it with a second RN, hang it for you, and I'll be sitting in the room with you for about 15 minutes after we've started, so monitor you for any side effects. Do you have any questions? No? All right. Can I just get you to sign your informed consent? And patient signs the informed consent, and I'm going to go ahead and start my pre-transfusion checklist. So I'm going to make sure that the lab has drawn a type and cross match, and they're going to draw that because we have to verify that we're getting the correct blood for our patient. Once that has been drawn and I get the correct blood, I'm going to be getting a blood band that I will be placing on my patient so that we know that this is they've received blood. All right. Then I'm going to go ahead with my second RN, start my verification process. I've already taken 15 minutes pre-transfusion vitals. I'm going to go ahead and check my blood with my second RN. I'm checking the ABO group. I'm checking the RH factor. I'm checking to make sure that this is packed red blood cells. I'm checking to make sure that the patient's blood bank number is the same on their ID band and the same on their blood and the same on their blood request form as well. And a second RN is with me to verify that this is all correct. Once we have verified this blood, I'm going to go ahead and start my procedure. So I have to check the patency of my IV. I'm going to close the patient's chart for now. I'm going to go ahead and scrub the hub for 30 seconds. And you want to do good friction. Okay, I'm flushing the line to check for patency. I'm going to first aspirate it to make sure I'm in the right place. Unclamp it. All right, I'm getting good blood return. I'm going to go ahead and flush the line. Okay, line is patent. I'm going to go ahead and set up my tubing. I got my blood tubing right here. I'm going to go ahead and look at the tubing, make sure there's no kinks, making sure there's no damage to the line. As I'm doing that, I'm also shutting all my clamps. Okay, taking off all these things I don't need. All right, so I got my normal saline. Normal saline is the only saline that can be run with blood, and it's not expired, and the bag is correct. I'm going to go ahead and spike that. Now I can use either one of these spikes. Okay, I'm going to go ahead and hang this, making sure. Okay, I'm going to unclamp my saline, and I'm going to fill the blood chamber all the way to the top, or fill it until the blood chamber is completely submerged. It take a little while. All right, so then I'm gonna go ahead and prime my line. Okay. And I wanna make sure I get a flow. Okay, that's good. Okay, I'm gonna go ahead and spike my blood. I've already verified it with the second RN. My patient's consent has already been signed, and I've already taken my pre-transfusion vital signs. I'm gonna go ahead and clamp my saline and unclamp the blood. I'm gonna spike it. Great. Hang my blood right here. Make sure I clamp the saline and I open the blood. And I want to make sure I get the blood in the blood chamber to prevent lysis. Then I'm going to prime the blood. You could take off this cap, just make sure you maintain sterility. And I'm going to prime it until I see a pink tinge at the end, because I don't want to waste any blood. Okay, I see the pink coming. And the pink is reaching the tip, and I'm going to go ahead and clamp it because I don't want to waste any blood. All right, I'm going to go ahead and hook it up to my patient, or let me put it in the pump first. Okay. 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 All right. Cool. So I'm going to go ahead, clean my port again, since I let it go. Hook it up. Now, according to our ATI policy, we set up the pump for no more than 2 ml for the first 15 minutes. So I'm going to go ahead and I'm going to hit channel select. I'm going to go to IV fluids, and I'm going to look down for packed red blood cells. Sure, it's right here. Okay. So my volume is 30 because 2 times 15 would be 30. And there's 4 15 minutes in an hour. So 4 times 30 would be 120. So my rate is going to be 120 and my volume is going to be 30 for the first 15 minutes only. So I'm going to go ahead and unclamp. I'm going to hit start and make sure that the blood has started dripping and the blood is dripping. Now you're going to remain with the patient for the first 15 minutes. Now, let's say 15 minutes has passed. I'm going to go ahead and pause. I'm going to check my patient for any adverse reaction. Mr. Moore, are you feeling any chills, fever, headache, anything like that, shortness of breath? Patient is verbalizing no, they do not. I'm also going to be checking another set of vitals, and everything seems to be within normal limits. Now I'm going to go ahead and set up my pump for the remainder of time. So, according to my doctor's order, I have to run 300 cc's. I'm going to just look at my doctor's order. Okay, I have to run 300 cc's in 3 hours. So I'm going to take my cc's, so 300 minus 30, because I just transfused 30. That's going to leave me with 270. Okay, now I got to think about the time. So we just transfused 15 minutes. Now we have to do minutes to hours because our pumps are only set up with milliliter per hour. So we divide 15 by 60 because there's 60 minutes in 1 hour, and you'll get 0.25 hours. That's how much has already gone into my patient. So I'm going to do 3 minus 0.25, and that's going to leave me with 2.75 hours. So then I'm just going to take my new volume, 270, I'm going to divide it by 2.75, and that's going to give me a rate of 98 milliliters an hour. Okay? So this is my math right there. I'm going to go ahead and set that up on my pump. I'm going to do channel select. My volume is going to be 270. My rate is going to be 98. And then I'm just gonna hit start. So, and I can verify here 98 and I can see 270 here. So my blood is gonna transfuse all the way into my patient. Now, the remainder time has passed, 2.75 hours. I'm gonna go ahead and pause. Now I see that there's blood remaining still in my line. So I wanna make sure the patient gets the entirety of the blood. And blood is only good for 4 hours. So since it has been less than 4 hours, I'm gonna go ahead and run the remainder blood into my patient. So the way we do this is you're gonna clamp the blood, you're gonna open the saline, and because the volume has already gone, right, we put 270, I'm gonna change the volume to about 25 cc because that's about how much is in the line. My rate stays the same because I wanna transfuse the remainder blood at the same rate that it was transfusing before. And then I'm just gonna hit start. And it's gonna finish the remainder of my blood. So once this is complete, I've completed, everything is good, I'm gonna go ahead and do channel off. My remainder blood has gone through. I'm gonna go ahead and disconnect my patient. I'm just gonna go ahead and clean the line. I'm gonna also flush the IV. Okay. And I'm waiting for it to dry a little bit. This is a new saline. Flush it, IV is good. I'm gonna go ahead and clamp it. I'm gonna throw all my supplies in the proper receptacle, which is the biohazard bag, since it is a blood. Okay. Mr. Moore, how are you feeling? Patient states he's feeling good. His post-transfusion vitals look great as well. I go ahead, throw all these away for him. All right, Mr. Moore, so this completes your procedure. Do you have any questions? Patient states no, he does not have any questions. I'm gonna go ahead and put the patient back together. I'm gonna do my last safety checks while I exit the room, making sure the bed is back in the lowest position. My oxygen and suction is still working. My floor is free of clutter. Mr. Moore, do you have any questions? No, patient states no. Call is within reach. Please call me if you need anything. I'm gonna go ahead and remove my gloves and perform hand hygiene. This completes the procedure.